Welcome to All In, a straight-shooting, science-based podcast about periods, fertility, and nurturing health outside of unrealistic beauty expectations. We will mostly, but not exclusively, focus on hypothalamic amenorrhea, HA, a component of the female athlete triad, and relative energy deficiency in sport.
I'm Dr. Nicola Rinaldi, scientist and lead author of the book No Period, Now What? I specialize in helping people understand how their eating, exercise, and lifestyle habits are keeping them from hormonal health and their best life. My work focuses on regaining periods, improving fertility, and breaking free of the rules of underlying diet culture.
My name is Florence Gillet. I'm a certified eating psychology coach and the founder of BeyondBodyImage.com. I specialize in mental recovery, helping people let go of toxic health beliefs to finally feel at ease in their bodies at any size.
Every 2 weeks, the All In podcast brings you real recovery stories, expert insights, and new scientific research on HA, hormonal health, and fertility, with an unmissable touch of body respect and women's empowerment.
Just a reminder that this podcast represents the opinions of the hosts and their guests. The content here should not be taken as medical advice. It is for informational purposes only, and because each person is so unique, please consult your healthcare professional for any medical questions. Music by the Andy Shulman Band, available on Spotify. Hello, Nicola. How are you?
I'm doing great today. How about you?
I'm doing great too. I'm very happy to be here with you, and we have a special guest today.
We do. I'm very excited to welcome Erin Kenney, who is a dietitian specializing in HA recovery and gut health, which I think is a topic that's on the minds of a lot of people through recovery. So I'm very excited for our conversation today.
Yeah, thanks for having me.
Yeah, welcome, Erin. Erin, can you tell us a little bit more about how you basically became a dietitian and what led you to where you are today?
Absolutely. So a lot of this was for selfish reasons, which I think would probably be, relatable to many people that go into any sort of healthcare field. Mm-hmm. But from a very young age, I had horrible digestive issues. My mom had me, on a special formula from the get-go. I was very colicky, and we're going to skip a lot of years and just go to my teenage years where I started struggling with some mental health issues. My hormones started to kick in, and that offers a whole range of different wonderful things that come along with being a female. And I also really loved food. So I've always really loved cooking and being in the kitchen. And so there's that kind of, I would say, more negative side of things, of struggles that I went through that was mental health. And then on the other spectrum, I really love food. I really love being creative. Being in the kitchen was always a really calming space for me. And then I struggled with some disordered eating. And a lot of this was because of my digestive issues. Mm-hmm. And also I went through a really bad breakup when I was in high school, which kind of fueled the fire, if you will. Mm-hmm. And so I was going into college, and I was moving out of my home, and I was not really sure what I wanted to do. I had a really good relationship with my mom, and I was kind of not looking forward to college the way that some people were. And so I just said, okay, well, I don't really know what I want to do, but I know I need help. And I know that I need to learn more about how to properly fuel my body and kind of how to do that through food. And so I just decided, okay, I'll, become a dietitian.
Cool.
Wonderful.
So what was your journey to becoming a dietitian like? Is it college and then additional schooling post-college, or?
Mm-hmm. Yep.
Mm-hmm.
So you can get your bachelor's degree in nutrition and dietetics, and then you are now required to go on and have a master's degree in some sort of, I don't think there's even actually any sort of rules on type of what that master's degree is, but I decided to get a master's degree in nutrition sciences, and then you go on to complete a dietetic internship, which is a different length depending on which program you choose and which focus you choose. But I went to Simmons University in Boston, which is an amazing dietetic internship. and you complete kind of like a residency where you do different rotations. You work in a clinical setting, you work in a long-term care setting, all of these different experiences to kind of get you to figure out what you want to do. And ultimately then you can choose, which path you want to take as a dietitian.
So I think that's something that I find really fascinating, is that, we tend to, people who don't really know about nutrition studies tend to believe that, are you a nutritionist or are you a dietitian? But actually dietitians go through a lot more than nutritionists, right? Because by the end of all of that, you've basically studied or been on an internship for how long?
For at least a year. And you're paying to do that, I want to mention, for anybody who's interested in taking that path, is, you pay to do that, and then you have to sit for an exam, and you have to pass the exam, and then if you want to, depending on the state that you live in, you have to, be licensed in the state to be a provider. So we are really clinically trained, and I always use the example for somebody who's wondering what level a dietitian is versus a nutritionist. We're the person in the hospital that's going to tell the doctor what tube feeding formula to put into the human body to keep a person alive. So a nutritionist could be anybody. It could be anybody from, your friend on Instagram who, really just likes food and nutrition, to someone who has a bachelor's degree in nutrition and wellness. So not that there's anything wrong, and I'm sure there's really great nutritionists out there, but it's really important to distinguish, who you're getting your information from. And the great thing about the RD...
Not your physical trainer at the gym.
Oh, yeah. That's a really common thing that I see in my own gym, actually, too. When I first signed up, they said, and we have, a trainer on board who can help you with your diet. And I said, no, are they a dietitian? And they said, no, they're just, educated in nutrition. And I just kind of, kept to myself there for a moment, and then explained what a dietitian was. And that's
thanks,
a really good
but no
point.
thanks.
Yeah, exactly.
So I know that you also experienced hypothalamic amenorrhea at some point. Can you tell us a little bit about that and your recovery journey?
Yeah, absolutely. I like to start this off with, it sounds kind of funny, but when I became a victim of diet culture and perfectionism, which is really where a lot of my HA journey started. This was when I was a junior in high school, and I had always been an athlete. So I know for some people, HA can affect all different types of people, but I was always an athlete growing up. I really loved sports. I loved soccer and basketball. And honestly, I never really cared too much about my weight until it was that point when I went through a really bad breakup and I wanted something to kind of focus on. I had this, this idea of control. I really liked the idea of control, which a lot of that stemmed from, some trauma that I experienced growing up. So I started dieting. I started cutting out certain food groups. Google told me all types of things that I could do to, burn fat and lose weight and do it really quickly. And that really led me down this awful path of losing my period, but not even realizing it because I was on birth control for about 8 years. I went to an endocrinologist. This is like very fast forward here because this has been a very long journey at this point. And so I went to an endocrinologist and I wanted to, figure out what was actually going on. And they actually diagnosed me with PCOS based on, based on an ultrasound. And I've listened to your episodes on this. I've read so much on this, and, so I was diagnosed with PCOS. And at this point I had done enough research and been, pretty educated on what PCOS was. I knew in my heart, okay, they're diagnosing me based just off an ultrasound. I haven't had a period in several years. I've been on birth control for so long. So I knew that this wasn't correct. So I went to get a second opinion. And, by the grace of God, this endocrinologist said, this is no period, now what? You should read this book.
Oh my God.
Yep. Yep. So this is a doctor in Boston, actually, and she gave me the book, and I was so excited. I remember calling my boyfriend at the time and being like, wow, like this book seems so cool. I joined the Facebook group online and I read the book and I learned so much, of course. And I started my journey, which was much longer than I would have liked. It took me about 2 years to get it back because I was not fully all in. I was teetering back and forth. I was not ready to give up exercise. I hadn't been in a place where I had support mental health wise. So after 2 years, finally, I did get my period back.
Yay.
And yes. And so I remember I was going to the conference, the food nutrition conference, and I saw that Nicola was going to be there presenting a poster, and I was so excited because I'm like, this woman literally changed my life. So that is my journey, and getting my period back, and just feeling like a normal human, feeling like a female again, and it was quite the journey, and I'm so grateful for you because of that.
Oh, thank you. I'm so glad that it worked out, and it was really fun to meet you in Washington. That was a few years ago now, but yeah.
My colleagues were like, who is that? Like, why are you getting so excited? I'm like, you need to read her book. It's going to change the world.
That is such a beautiful story. Thank you so much, Erin, for sharing that. And I'm interested how did your recovery actually inform the way you practice dietetics?
Yeah, and very much so has changed the way that I work with patients, and especially when it comes to gut health, because I think the biggest misconception around digestive issues is if you're having issues with digestion, that means that you're putting something in your body that's causing some sort of upset. And quite frankly, a lot of practitioners will start by treating this with restrictive diets, the low FODMAP diet. A doctor will tell them they have IBS. And I've been there. I have been that patient. I've done the food sensitivity tests that created like a ingrained fear of things like asparagus. And so now when a patient comes to me, we don't start by focusing on taking out, because now I know, and through research, of course, that restriction is not how you heal your body. It's not how you heal your gut. It's about supporting the body with all of the nutritional, adequacies that your body needs, fueling yourself properly. And then once we do those things, then we can even have a discussion about, potential food sensitivities. But gut health is so complex. There is the mental health aspect of it. There's the physical aspect of it. Of course, food plays a role in it, but it's so much more. And if we're just looking at the food side of things, then we're really missing a huge, component of what that person's healing journey is going to look like, and the success in that journey. And then the second thing I would say that's been a major shift is just learning about the female body, and learning about the inner workings, and how food plays a role in that, and how your digestion and absorption plays a role in that. So it's made a huge difference. And I think that that's what clients love, is when we have a discovery call and they say, what's your approach? My first response is not, oh, well, we're going to try the low FODMAP diet, or we're going to cut things out. My first response is, well, we fill in the gaps. We figure out what you're not eating, the nutrients that you're not getting, what you're deficient in. And then we start to think about the other types of things.
And I'm interested also to know if you found that after recovering from HA, you were still struggling with the digestive issues that you seem to have been struggling with since birth, right?
Yeah, that was my question too.
Yeah, and that's a great question. And it was, I actually still have journal entries from this period of my life, which I encourage everybody to do, especially if, this is a lifelong journey, right? So it's something that can be really helpful to look back on. And of course, my digestive issues have never been perfect since, but they are, to say that I had an intolerance to certain foods or food sensitivities, those have been completely eliminated. And the answer is yes. I was able to eat things that I just remember drinking a smoothie even, and thinking to myself, like, I would never even thought that my body could handle this. And it was all just a result of properly fueling.
That's fascinating. So do you think that you were under fueling at a young age even, and that was contributing? Or do you think what do you think what do you think was going on when you were a child that has changed since you've grown up?
Yeah. So I think honestly, if we start at the very beginning, we know that in evidence-based concept is that the gut microbiome composition that your parent has is transferred over to, the baby. And so when you are born, you are supposed to have a robust immune system and things are supposed to look really great in that situation for your gut health and have a healthy balance of bacteria. So I think that I started off with a less than optimal gut microbial balance, considering my mom struggled with the same exact thing and she probably passed that on to me. And then,
Wow.
yeah, and then so they termed my diagnosis as lactose intolerant. So they cut out dairy, and I don't know if I've never really explored a lot of the psychological, potential contributions to this, but I wasn't supposed to eat dairy, so I ate dairy all the time. I ate candy all the time. I was constantly, eating these foods that were making me feel really sick. And I just remember a lot of my childhood was spent in the bathroom with horrible stomach aches. And so I know that when I got older, a lot of the fear around food was I don't want to feel sick. I don't want to, I don't want to have that feeling. I want to control my food so that I don't have that ever again. So I know that was kind of a long-winded answer, but I think it was very complex of how that kind of started off. And then of course you think about if you are eating all these foods that, I was eating tons of candy and dairy that was kind of moving right through me. So my issue was diarrhea all the time. And so if you're thinking about that, you're not actually absorbing things. And so I was clearly malnourished in some way. I was malnourished. You could see it in my nails. You could see it in my hair. I was very thin. So there was a lot of physiological signs that showed that I was in some way malnourished.
It's really interesting to think about the idea that if when we are pregnant, we are restricting, that can have negative impacts on our future children. I mean, that's not something that you really hear in the sort of common media. It's all about don't gain too much weight. I mean, everything, don't gain too much weight. And yet there's no real discussion about how some of the restriction that can be occurring during pregnancy in order not to gain too much weight could have these long-term impacts. So I think that's really something that would be very interesting to explore further.
Mm-hmm. And there's research to support that. I mean, we can talk about the impact of, even just excessive coffee consumption can have on the neuro behavior of a child that is born to that parent that's drinking that much caffeine. So there's all of these habits that we have research on to show are linked to certain outcomes in their offspring. So it would be really interesting to follow that research, and that's not a time to be restricting.
And am I right to think that dieting typically also impacts your microbiome negatively? I mean, we have this idea that if, I was totally there with you, Erin, thinking if I eliminate whatever is making me, for me, it was not making me sick. It was like physically sick, but it was, I was diagnosed with Hashimoto's after my first pregnancy. So I had this whole narrative of inflammation and, the whole autoimmune. And then obviously I had acne and I was like obsessed with it. So when I was eliminating, you kind of buy into the message that if you eliminate all those almost like impure foods, right? You're only going to put in your body what your body can tolerate and whatever. But the reality is the more you restrict, the less your microbiome is actually diverse. Am I correct? Because
Yep.
I'm definitely not a dietitian, so please give us the right information.
No, you are correct, and there is a pretty decent amount of research to support this. That specifically looking at patients with anorexia nervosa and restriction and dieting, their gut microbiome is significantly less diverse. And what we know from the research is that having a more diverse gut microbiome is optimal for several markers of health. So when we have any form of restriction or cutting of food groups, we lose that diversity of bacteria, and it can be really hard to trust your body and to come back from that when, there's a lot of fear based around the food.
Totally.
If you have a few references that you could share with us to put in the show notes about that, that would be fantastic.
Absolutely. I have them already ready for you.
Perfect.
Wonderful. So I think we kind of talked about, how you help people with digestive discomfort and how it was related to your own story. But I think the next question that I wanted to ask you about was about what really happens to our digestive system when we are underfueling and dieting, and what would that look like short term, but possibly also long term?
And this is a great question. And I think, and I love research. Trust me, I could spend days doing research, but I think there's also a lot of things that I'm going to say right now that don't even necessarily have research to back them up, but are probably a consequence of, underfueling. And I'll use an example at the end. So short term, we're looking at things just like constipation. So, I talk to clients about this all the time. You have to think about your digestive system like a tube. So you have to have momentum moving through that tube in order to produce a healthy bowel movement. You have to have fats that are lubricating. You have to have carbs that are feeding bacteria. You have to have protein because your gut is a muscle. So remembering that all of those things are going to be beneficial for just having a healthy daily bowel movement, which, being constipated is the worst feeling. We all know that, right? And then bloating. So bloating is another one. So if you're constipated, you're probably going to be bloated. And then, further down the line, that can lead to acid reflux. Because you're bloated, because you're constipated, you're not having movement through there, and things can be kind of coming up. There might be a lot of pressure in your abdomen due to slow motility. That can lead to then low appetite, dysbiosis. So that means the imbalance of healthy and neutral and negative bacteria. And this can actually happen fairly quickly from restriction, because the diet change that happens can, within 24 hours, eating can change the composition of your gut microbiome.
Wow.
Yeah. So pretty profound short-term consequences of underfueling, and then long-term. And so when I say long-term, this could be a month, this could be 2 months, depending on how severely the person is restricting. But the biggest one that I like to highlight is atrophy of the GI muscles. So we have to remember that the GI tract is composed of muscle. And so when we are underfueling, that means that muscle needs to be repaired, and it needs that energy in order to stay nice and strong, the same way that any other muscle in the body does. And so when you don't have a robust, healthy muscular system in your GI tract, then constipation, gastroparesis, really slow, even slower movement of things through the GI tract. And then we look at things like food sensitivities. So we can talk about foods being inflammatory all day. Underfueling is inflammatory because it's a stress on your body. It's going to cause cortisol release in your body, which is that stress hormone, that can wreak havoc on your gut just because you're not feeding yourself properly. Low stomach acid. So low stomach acid, which can be a result of chronic stress. It can be a result of not getting enough B12, vitamin D, zinc, which can all be from not eating a diverse range of foods. So low stomach acid is really common. And then malabsorption. So if you then have the stress that's going on in the GI tract and inflammation, then you're not going to absorb things as well, paired with the low stomach acid. And then I see a lot of autoimmune conditions, especially as these types of things like underfueling continue years down the road. It's a stress on the body. Stress can trigger autoimmune conditions, especially in the gut. And the example that I wanted to use was I worked with a woman one time, and she had gone to the top doctors in Boston trying to figure out her chronic migraines, and, tried cutting all these different foods out and, this and that. And then at the point that she made it to me, we did a 3-day food record, as I do with my clients, and she had actually been under fueling. Mm-hmm. And so for 30 or something years of her life, she had been under fueling and suffering from severe migraines. So all of these things can show up in different ways, but the digestive ones are definitely something to be concerned about.
Wow, that's way more than I would even have imagined. I know we always think when we're dieting, we're losing fat. That's like that's what everybody thinks. You get that 6-pack. All of the things. It's always you only think about the fat. You tend not to think about all the other consequences to your body. So there was a study that I saw. It was in mice, but they found that when a mouse lost 10% of their body weight, they lost 20% of their kidney size and like 30% of their liver size. Mm-hmm. And so it seems like there's extremely negative effects on our digestive tract as well, in that all stems from the underfueling and this fear of fat that we have in our society. And yeah, it's just...
And dieting never comes with a warning, right? It's kind of interesting how there's so much misinformation out there. And so people are kind of sold all sorts of diets under the umbrella of wellness and health. But this should be like you have on the cigarettes packs, you have like, this can cause cancer, right? You should really have something to say like, well, dieting is really harmful, and it really doesn't work for people typically. Like, it's just such a small percentage that might actually maybe benefit from it, but most of us actually go crazy, or we kind of lose the healthy relationship we have with food, or it's all sorts of different
people.
Yeah, different, physical symptoms. And I definitely feel like, as you say, with the long-term effects, I definitely believe that many of us who develop, for example, Hashimoto's, and I know it's multifactorial, like it's not just the dieting, but I can't help but wonder, what actually triggers all of those things. And I think, this is one of the things, like, we have to live with this for the rest of our lives. So I wish diets were actually sold with a proper warning of what they can cause. But thank you so much. I think I had not imagined it was that bad, to be honest.
And honestly, Nicola brought up a really good point about the different organ systems in the body, and that's something that I didn't address. And when we look at, really severe eating disorders, there's organ failure involved with that. And so you have to remember your pancreas, your liver, your gallbladder, those are the things that are making digestive enzymes, and they're making bile to break down fats. And so if those aren't getting enough fuel, then they're going to stop doing their functions. And so it's really important to remember that it can be serious, it can be life-threatening, you can have electrolyte imbalances. That the things that I listed are just some of the few. I could talk about it for days, honestly.
Yeah, and actually we talk about some of those in episode 8 with Dr. Gordiani. So if anybody wants to hear more about the medical complications of eating disorders, this is something we kind of talked about with her.
Right.
So one more question that I have, Erin, is it's quite clear from everything you've been saying that underfueling can cause perceived food intolerances. How would you distinguish between an intolerance that comes from underfueling versus something that has a different etiology? So, is a true intolerance. Like my niece, for example, is gluten intolerant, and her entire life she's gotten really, really awful stomach aches from eating gluten. So it was never it actually took them a long time to figure out that was what the issue was. But that to me seems like that is a case where it was not due to initial underfueling. So how would you tell the difference?
Yeah. So if a client comes to me and they suspect that they do have a food intolerance, depending on what food it is, if it's like a carrot or something like that, that's a random food that they know they just don't do well with. Not eating carrots is not going to significantly impact the nutrients that they're getting. So we might have them, okay, cut it out for a little while and then reintroduce it. But if someone thinks they're allergic to dairy or wheat or gluten or something like that, then there are clinical tests that we can do to, determine if that reaction is significant enough. I do a lot of stool testing in my practice. So if that reaction is enough to warrant us to eliminate that food. But ultimately, the goal is once your body is in a state of, lowered inflammation, meaning properly fueling, are you getting omega-3s? Do you have adequate vitamin D levels, which are responsible for your immune response? Drinking enough water, all these things that can help create a healthy response from the immune system. Then we kind of can, if we can wait till that point where the body is properly fueled, and I don't even mean properly fueled calorie wise, but nutritionally adequate. And it's in the sense of those, nutrients that I just stated, for example. So as long as they have those things, then we can say, okay, now you're at a good point where you're getting all the things you need. If you're still reacting to this food, let's do a little trial and error where we cut it out for a significant amount of time, whether it's, a few weeks or a month, and then we start to reintroduce that food in a systematic way. And I help clients identify what a true, negative response is. If you find that you get bloated when you eat a certain food, well, you haven't eaten that food in a long time. So lactose intolerance, for example, is a good thing to use as an example because if you cut out dairy for a long period of time, your body is actually going to stop making lactase, which is the enzyme that helps to break down the sugar in milk. So if you have cut out dairy for a long time and you start to eat it again and you get a little bit of looser stools or some bloating, then it could just be because your body's transitioning back into, tolerating that food again and making those enzymes again. And the same can go for, other foods where, as I mentioned, your gut microbiome will change. So the bacterial composition will change. And so as you do that, you might be boosting those beneficial bacteria that are now fighting off and balancing out those, more negative bacteria to create a healthier balance. So it's important to just not jump to this is a food sensitivity because I had a reaction. And if you do truly think it is, then, if you think it's gluten, then let's do a blood test and let's see how your, body is reacting to it. If it's dairy, let's start with doing low lactose dairy and then we start there and then we can, start to play around with maybe ice cream and things like that have a higher lactose content. So it's all about weeding it out, figuring out the symptoms, but then also knowing how to read your body when you do reintroduce a food to determine whether or not that's a reaction that is something that might end up kind of evening out once you're in a good spot.
Yeah, I've seen a statistic, speaking of dairy and lactose and everything, that something like 7 out of 10 people are truly dairy intolerant and it causes inflammation. And can you debunk that for us?
Yeah, I mean, I can just tell you from based on my clients, 7 out of 10 of my clients tolerate dairy. So I think that it's a very common food that I add back in with clients, especially because it can be really beneficial for recovering a period. And so high-fat dairy products, I mean, they're a great source of vitamin D and calcium. And when I add it back in, I can tell you that it's pretty standard. My client will say, well, I've cut out dairy and I'm not really sure if it bothers me. And I'll say, well, let's just try it next week. Let's give it a try next week. Every single client says this to me. They say, well, I tried it. I was a little bit bloated for a day or two. And I listened to what you said. And now I seem to be fine. I kid you not. Every client says that to me. Almost every. Like there are, of course, a few that might not truly tolerate dairy. But more often than not, people are surprised that they probably had this idea in their head that dairy's bad because of, somebody that told them that.
And it's really there's a lot of fashionable ways of eating, and those change all the time, right? So I find that dairy really has a kind of bad rap right now.
Yeah.
But when I was still in my relapse, it was gluten. And, I grew up thinking that fats were really bad for you. So you can see that it kind of rotates. It's not really founded in anything. It's not really rooted in proper science. It's kind of suddenly everybody wants to have like almond milk, and it's like the thing to have. While, 5 years ago, you could never find almond milk anywhere. If you were really intolerant, it was really difficult to find that anywhere. So I mean, it's just, and it's so interesting that obviously people might tolerate it better after they come out of restriction, because then you help build them up in terms of having the right microbiome and all of that. And so it's just crazy to me, like the amount of misinformation out there. And it goes back to what we said in the beginning. Do not trust like anyone that doesn't have a good amount of knowledge around nutrition, right? So
yeah, and if you look at the ingredients too, so you want to talk about whole milk. What are the ingredients? The ingredients are whole milk, right? And what are the ingredients in some almond milks you're going to find? Xanthan gum and, all these fortified vitamins, which can be good for somebody. That might be helpful. But for a lot of people, these alternative items, these gluten-free breads, these things, they can actually make your digestion worse because they know you're going to pay extra for it. They know it's trendy. And we're not talking about someone who has celiac or someone who truly has an allergy and intolerance, but I'm going to choose a gluten-free bread because it's healthier. Well, oftentimes these products have, all these gums and binders and preservatives and things that what's in beef versus what's in a fake meat burger. You've got a significant list of ingredients in these alternative products that can be causing digestive issues.
Totally. And it's again, diet culture kind of selling us stuff on the back of becoming thin or, healthy. But at the end of the day, they're selling us food that is not as, close to nature. They're kind of creating all sorts of products, but then they will tell you avoid like processed candy or something. And you're like, how is this working?
Yep.
But quite interesting. Another kind of common diagnosis is SIBO, right? And we were wondering if you see that in your clients and what kind of thoughts you have around the diagnosis of SIBO and how this interacts with kind of people wanting to recover their periods. Like, what should they do? Because obviously you do feel that there is pain, right? It's these people are suffering. We're not, and I find that sometimes it's difficult. You do want to validate their experience, but you kind of want to say to them, actually, you're going to have to refuel and kind of get over that hump. So, I mean, I think the main thing that we're trying to get to here is like, are there maybe ways that we can support them in that recovery if they are, quote unquote, intolerant or having SIBO? But I'm interested more specifically to know what you think about SIBO, and can it be also maybe tested properly?
Yeah, in SIBO, there's a lot of nuances to this because, even among the gastroenterology clinics, around the world of what is the proper way to test for it, what's the most accurate way. We have the breath test, we have the blood test, we have biopsies, and there's still a lot of parsing out on which is the best method. But if someone, sorry, go ahead.
So just a quick interruption. Can you define SIBO for us? Because everybody listening may not know what that is.
Yeah, so small intestinal bacterial overgrowth. So typically this is an overgrowth of bacteria where we typically shouldn't have an overgrowth. And it can cause plenty of unpleasant symptoms, most of which are very just isolated to the GI tract. And further down the road, this can lead to thyroid issues. It can lead to nutrient deficiencies, and this can put definitely some of a roadblock into getting fully through recovery because your body is under that state of stress, and you do want to eradicate that overgrowth. You want to kill that bacteria that's in the small intestine. Now, the biggest point to mention here is, you can kill the overgrowth, but the most common thing that I see in my practice is reoccurrence of SIBO. So if somebody is trying to get rid of SIBO, but they're still under fueling or they're not nutritionally adequate, then if they're constipated, for example, or if they're just not, fueling properly, if they're under a lot of stress, over exercising, the SIBO is just going to come back. So refueling and reducing stress on your body, resting more, things like that are going to be crucial as part of the SIBO treatment. Now, you can go to a physician, you can do a breath test. That's one of the most common ways to do it. With the pandemic, we're doing, at-home tests right now. So that's a good way to test for it. And if you do have it, then you can decide to go the, conventional medicine standpoint. You can do the antimicrobials from your physician, or you can do a herbal antimicrobial, which I do with some of the clients in my practice. Now, which one you choose really doesn't matter. There's a lot of research on both ends. They've shown that the herbal routes can be just as effective as the antibiotics. People freak out when they hear antibiotics, but the thing about the antibiotics that are used to treat SIBO is that they're solely isolated to the small intestine. So they're not gonna work systemically. They're not the way that most antibiotics are working in a negative sense. So rifaximin, for example, it's a safe antibiotic. You shouldn't be worried about doing it during part of your treatment in terms of the long-term health effects. But a lot of diets out there will say, okay, we'll go on the low FODMAP diet. That's going to starve the overgrowth of bacteria. Now, this can be really, really troubling for someone who is, struggling with food rules and restriction. And quite frankly, I don't treat it this way in my practice. I would never have somebody go on a restrictive diet, because think of it like hide and seek. If you are trying to find somebody and they're hiding, it's going to be harder to find them, right? Same with the bacteria in the intestine that you're trying to kill. So I tell my clients, you resume a normal diet and you go through the antimicrobial treatment, and we feed back as comfortably as possible. So we'll focus on things like white rice, if that's what they tolerate, or we really walk through the foods that they know are not major triggers for them without restricting. And then we go through that killing protocol and continue to focus on making sure that we get to the root cause of why that SIBO got there in the first place. If it was because they didn't have the right probiotics in their gut, if it's because they didn't have motility that was causing them to have a daily bowel movement, and stress. I think that's an underrated aspect of all of these conditions. SIBO, Candida is stress.
That's great.
Absolutely.
I think that's going to be of great help to our listeners to know that you don't have to go starve the bacteria to get better. And just working with the right practitioners, right, is actually going to be most valuable for sure.
Yeah.
So getting back a little bit to HA and recovery from that, and recovery from disordered eating, a lot of people find that as they are going through the process of eating more and adding different foods to their diet, that they do have a lot of bloating or discomfort, constipation, diarrhea, all kinds of weird things going on digestively. So one of the suggestions that I made in No Period Now What was reducing vegetable intake, because it seems like a lot of people sort of try and eat foods that are low in energy in order, that's part of high volume but low energy foods are part of how people, trick their body into thinking it's getting food when it's really not. And so often I find that when people do reduce their vegetable intake, that their bloating and other symptoms improve. Do you find that as well? And are there other tips and tricks that you could recommend to people to deal with some of these symptoms?
Yeah, definitely. And I think there's several different areas that we can take this. So one of them too is that, if you're eating an excessive amount of fiber, this can really lower your estrogen levels. And there's actually research to show this. And we know that estrogen is really healthy. It's really healthy for bowel movements and motility. It's also really helpful for getting your period back. So that's one aspect of it. And number two would be, how are the vegetables prepared? So are you eating a big raw salad for your meal? And that's a lot of volume, and it's going to fill you up, and you're not, going to be hungry for other foods that are more nutrient dense. So I recommend really lower volume. Cook your vegetables, toss them in, oil so that you're really absorbing the fat soluble vitamins. Don't snack on raw veggies. That's a thing I see as being really common. A lot of raw snacking on veggies. Focus on really nutrient dense ones and then lower your total intake. So for example, if you're eating a lot of romaine lettuce, screw the romaine lettuce. Like, forget about the romaine lettuce. You don't need that. Get yourself some kale, saute some kale, cook it down, add it to a stir fry or something like that. So you're getting really nutrient dense, calcium, folate, all of those nutrients, but it's not a ton of volume. And then variety. So if you're eating, all of the cruciferous vegetables, if you're eating kale and broccoli and cauliflower and cabbage, all of those foods are in a group that produces a lot of gas in the gut, and that can create a lot of discomfort. So we live in the world where everything's made of cauliflower nowadays. You can find it in chips. You can find your pasta made out of it. And this brings in the conversation of like pasta made out of beans and stuff like that. Anytime I have a client that comes to me eating, all these types of vegetables, we're focusing on variety. So if you're going to eat those vegetables, eat them, like I said, cook them down, make them easier to digest. Don't focus on high volume like salads and things like that. Don't really snack on vegetables. So I would definitely agree with the method of cooking, reducing high volume vegetables and getting really just nutrient dense ones so that you can get more nutrition out of less volume.
Great. And anything else you can recommend, like in terms of dealing with some of the symptoms that people can experience in recovery? I'm thinking, for example, of constipation, like you said in the beginning, like when suddenly we actually, a lot of people will actually go all in, like cold turkey, right? They will go from eating very little and then, say like, what the hell? I've tried all the other ways. It doesn't work. I'm just going to jump and do the all-in method. And then obviously after 3 days, they feel horrible. And they're like, what the hell am I doing? This is harmful. Like, so is there anything that could help, I don't know, in terms of supplementation or maybe some stuff that can help kind of encourage motility at that time where suddenly your digestive system is like, what's going on?
Yeah, absolutely. And I will give you a bunch of tips and I'll try to do it as quickly as possible. So natural prokinetics are really great. Prokinetics mean that they stimulate the GI tract to move. And so that's things like ginger, and then probiotics. So probiotics can actually act as a prokinetic. Now, if you don't have access to probiotic, you could take some in food sources like dairy and kimchi and miso, all of these fermented foods. They might be a lot for somebody who's just starting out. So really start with a very small portion size of them, or taking a supplement. I usually recommend people take it at night before they go to bed, and this sometimes can help have the prokinetic effect, and then they wake up and maybe have a more normal bowel movement. For constipation, there are some evidence-based tips for constipation. So two kiwis a day has been shown to help constipation. And you can eat the skins of them if you wash them, if you wash the outsides. Little fun tip.
Wow.
Yeah, your face, Florence.
Yeah, I'm not sure about the texture. I'm not sure. I mean... Yeah,
your homework is going to be to give it a try, because I've started a trend on social media and I'm on a mission to get people to try it. So 2 kiwis a day. You don't have to eat the skin. I'm just being funny. And then psyllium husk, so 12 grams of psyllium mixed with water has been shown to be really beneficial. And then 2 prunes a day can be really helpful if you're feeling really backed up.
And that's good for bone density too.
Yep, it's great for bone density. That's a great point. I don't think a lot of people know that. And then there are also other things that can really help with bloating. So peppermint tea can really help relieve gas. Peppermint tea helps to relax the muscles of the GI tract and reduce the spasms that are happening, so it can help you pass gas more easily. And then yoga. I'm a huge fan of yoga and meditation. A lot of people are recommended to try the low FODMAP diet. I've spent hours doing research on the benefits of yoga and meditation compared to the low FODMAP diet, and they can be just as effective. What's it called, that the cat cow pose, where you get on all fours and you kind of up move your spine in different positions, that can really help relieve gas. It can stimulate your digestion. You can also YouTube like Yoga with Adriene. She has some really great.
I've just started doing her too.
She's got some great digestion focus videos. You could practice some self massage, which is also a really great way to kind of just give your gut some love. I know that a lot of females, including myself, have had a really negative relationship with that part of your body. Just like this idea of something that might feel bloated, or you might not like that you have body fat there. So it can kind of create a connection with that area of your body, doing that self-massage. Yeah. That's actually something my therapist taught me years ago, and I started incorporating it with clients. Even just placing your hand on your digestive tract can start to really you're almost like reestablishing a relationship that may have been disconnected for a while. So
that's so important. And I think you're right. The tummy tends to be one of the areas that women don't feel comfortable with. And unfortunately, it means that I think there's a strong connection between our mind and our bodies. So I think hate your tummy, and of course you might possibly also get some digestive symptoms, right? If you really want to get rid of that part, which is actually helping us all the way, any way that we treat it, even if we treat it really bad. Those are great. Thank you so much, Erin.
Yeah. One more thing too is, so digestive enzymes for some people might be helpful while they're refueling, because if your body is underfueled, you might not be producing the right enzymes. And chewing your food. So this sounds silly, but your digestion starts in your mouth, and if you're not making contact with those digestive juices in your mouth, then this can just make it harder for what the rest of your digestive tract has to do in terms of breaking it down. So I'm definitely not perfect. I don't chew my food completely every time, but just really try to set aside distractions, chew your food, be present with it as best as you can.
That's great.
Wow, that's another thing that I never really thought about. So thank you. That's incredibly
and I think
helpful.
those are lovely, because they are really not about, as you said in the beginning, it's not taking out, it's actually adding in, right? It's actually taking more, probiotics or enzymes or ginger or whatever it's going to be, so that you can support your system rather than actually remove stuff from it, right?
Yeah.
So that's beautiful. Is there anything else that you wanted to add, Erin, maybe, that we didn't really talk about?
No,
that you wanted to...
I think that's a lot of people will think that digestive issues are all in their head, because doctors will tell them things like meditation and yoga. So I want to make it clear too, when I say that those things are really effective, it's not necessarily because it's all in their head, but because our gut and our brain are directly connected. And so when you focus on that relationship, that can be really helpful. So just remember that there's so much that can be done in terms of adding in and focusing on self-care and stress reduction, and thinking of your digestive system as kind of like a little kid or someone who needs a little bit more love and nourishment, and that can really help with improving all your digestive symptoms as well.
And I think I'd like to add also, like for me, lots of people don't connect to meditation, but I think mindfulness is much more than meditation. So something like holding a gratitude journal is still like a practice that I would see part of being mindful. As you said, like eating without distraction is also a way that you can actually connect to the present moment instead of kind of already thinking of something else or listening to something else. And then, lots of practices. I find that anytime people feel too stressed. It will be about, how do I connect to this present moment? And I'm not kind of pushing myself to go in the future or coming back to the past. So sometimes I find that I don't drive anymore because I don't go anywhere. But when I used to drive, like I remember thinking like, okay, I'm not going to put music on or podcast or anything. I'm just going to focus on the driving part. And it feels like when you're able to do that, even for short amounts of time, maybe 3 minutes a day or something, you feel this kind of relief, immediate. So I think this is something, if people want, I will put in the show notes some resources, but if people don't connect to meditation and they still want to get the benefits, there's plenty of ways to get there, I think. So Erin, you might know, you might have listened to other episodes, that one of the questions that we like to finish with is asking our guests, how are they all in right now? So not so much in the sense of recovery per se, like really, eating more and resting more and all of that, but really how they're showing up fully in their lives and how they are being totally present in whatever they're doing or taking care of themselves, like really being all in is what we mean by that. So how does that materialize for you right now?
And the word you just said was being present. And this is something that I think it's almost like when you go through something that's really stressful and you get to the end of it and you're kind of like exhausted. I feel like this past year, I have been putting so much energy into really helping all of my clients, and especially during this pandemic, I myself have been trying my best to, focus on self-care and doing the best that I can while serving my clients in a time when they really need me. So I think I've been a lot less present and just kind of really focused on specifically my career. And so right now, what I'm really trying to manifest, and a lot of this is working with my therapist as well, is just learning to be present and knowing that, the thing that you mentioned about just being in the car and not having any music on, I've just been really kind of tuning into how to just exist and enjoy the beauty of being here physically without having an agenda or a to-do list. And it's been wonderful so far. And it's a very challenging journey, but the next season, I will call it, I would say this time of year for me is always really transformative. And so that will be just be will be my mantra. And
I love that.
Yeah.
Yeah.
Great. That's great.
So I'd like to put in a plug for your podcast as well. So I was a guest on that a few months ago, and I would encourage our listeners to go and check that out, because I think we also talked about some other different tips for gut health in that episode. And, I'm sure your other episodes as well. Aside from that, where can people find you and connect with you? Because I think there are probably a lot of people who would be interested in working with you. So
Yeah, absolutely. So you can find me at nutritionrewired.com. Another thing too is my podcast. My podcast is on there. My blog's on there. You can find my Instagram through there. You can email me. But I also work with a lot of clients who are athletes, and that's very common when, among HA as well. And so if people are interested, there's a really great episode that I just did with Stacy Sims about how to work with your physiology and train and eat if you are someone who has recovered or wants to learn about how hormones can play a role in digestion and stuff, because that's a whole nother topic. So
very cool.
Yeah.
Awesome. Thank you so much, Erin. That was really great.
Yes, thank you. I mean, so many helpful tips and ways for people to think about food and digestion totally differently from what we're used to. So much appreciate your being on here with us.
It's truly my pleasure. Thank you for all the work that you have both been doing. I love that you have a podcast. I am so thrilled.
Thank you so much. And have a lovely rest of the day.
You as well.
Bye.
Bye. All right. I hope you enjoyed this episode. Maybe take a few minutes to reflect on it and how you have been all in this past week. It always strikes me how different each person's all-in journey is. As I often say, there are many paths to HA and many paths out of it. Your journey is unique.
That is so true. And if you need more support on your journey, you should definitely start with No Period Now What, which you can get at noperiod.info/book.
And Florence and I both work with people on different aspects of period recovery and so much more. So if you'd like more personal advice and attention, you can go to noperiod.info/appointments to schedule a time to speak with me on fixing the issues underlying your missing periods and figuring out what those issues are.
And I'm at beyondbodyimage.com to work with me on the deeper emotional issues and your body image. I also run a French Instagram account, amenoré_fr. And obviously you can find Nicola at No Period Now What on Instagram. We also have joint clients, so you can access both our domains of expertise at the same time. If you enjoyed this podcast and found it helpful, please drop us a review to help more people find it.
Also, join the No Period Now What recovery support group at noperiod.info/support and let us know how All In is going for you.
All In is not just about period recovery, it's about getting your life back. See you in 2 weeks.
You were lost in fat loss till you got lost again. You were lost in fat loss. Now find yourself and then take all that you've learned about what love and loss, pleasure and pain, and never get lost again.